We have almost as many cases in Yakima as in all of the state of Oregon, only they have 16 to 17 times more people, about 4 million people living in Oregon.
Hi, I'm Scott Leadingham. Thanks for joining us here in the unique Northwest. Just when you thought it was safe to go out, here comes a masking requirement from Governor Jay Inslee to make it safer going out here in the state of Washington. And joining us to talk a little bit more about it is someone who is very much in the heart of some of the areas that are affected by coronavirus. That is Enrique Pérez de Rosa joining us from Yakima. Thanks for joining us today, Enrique.
Thanks for having me.
You're there in probably at this point what is the hardest hit area, not only in the state of Washington, but one of the hardest hit areas in the western U.S. Tell us, just overview the situation in Yakima County.
Quickly, by the numbers, in the last 2 weeks in Yakima, we've had an increase of about 1,500 cases. And that's among the highest, not just in the West Coast, but in the entire country. And we're quickly approaching 7,000 cases. That's about 3% of our local population. If that doesn't seem bad enough, we have almost as many cases in Yakima as in all of the state of Oregon, only they have 16 to 17 times more people, about 4 million people living in Oregon. So, things are very alarming here. And it's not just in terms of the number of cases, but in terms of the number of hospitalizations too. Those are also on the rise. And they've doubled over the last 2 weeks at about 60 people hospitalized as we record. And 60 doesn't maybe seem like a lot to regular people that aren't familiar with how COVID-19 patients are treated, but essentially each patient is a big toll on hospital resources like staffing, especially in critical care where people are on ventilators or intubated. Put it one way, 60 COVID-19 patients is more like treating 120 regular patients in terms of that toll on resources like staffing. So if cases and hospitalizations continue to keep going up, there's really no way that we're ever opening up. And so our only hope is using masks to slow the spread.
So on that topic of masks, Governor Inslee, of course, recently announced that statewide mandate for wearing masks in public when you're inside places of business and even when you're outside if you cannot maintain 6 feet of social distance. But it is a little more stringent in Yakima County. Tell us a little bit about what that order is. And two, how have generally people been responding to masking in Yakima County? There was a previous health district directive from just the county level in Yakima County. How were they following that previously?
Right. So the mandate is pretty similar here in Yakima as it is statewide. People have to wear masks in public, especially indoors and when they're inside businesses. But in Yakima, those businesses have to require customers to wear masks. So no mask means you got no service. So the interesting question is, why is Yakima County being targeted here? Is this level of mandate needed here more than in other places? The health district conducted a survey in late May that found that only 35% of people observed going into open businesses or like grocery stores, only 35% of those people wore masks. And so that prompted the health district to issue a masking directive that strongly encouraged people to wear masks. And so the health district implemented this messaging campaign urging people to wear masks. And a month later, the health district announced just yesterday that 65% of people are wearing masks. And so that's a lot of progress. And it didn't take a mandate from the governor or any sort of strong enforcement to get people to get serious about masks. The question now is that enough? And, the health district wants 80% of residents to wear masks to curb the growth of COVID-19. And so the mandate might just be that extra push that Yakima needs to get there.
Enrique, much of the cases that we've seen in the earlier parts of the pandemic since March were attributed to long-term care facilities, nursing homes, and the agricultural sector, specifically food processing warehouses, fruit packing warehouses, things like that. Is that still the case in Yakima, or are some of these cases that we've seen in the last few weeks, that rapid rise, been in other areas, general community spread?
Yeah, those industries and places are definitely high risk of big outbreaks. And of course, nursing homes and long-term care facilities. That's a very vulnerable population. So the health district is keeping an eye there. And with agriculture, a lot of those workers are Hispanic, and we've seen across the nation, and certainly in Yakima, that the Latino population suffers disproportionately from coronavirus. So yes, those places are a concern right now, and the health district is doing their best to keep an eye on them. But the main driver generally is community spread here, and that is because we depend economically on agriculture. And that's, of course, an essential industry that from the beginning of the pandemic didn't shut down. And that means that there's a lot more essential workers here. And in turn, that means a lot of people are moving around. There's still a lot of economic activity, people going to work, interacting with people, and of course, potentially spreading the virus. So going back to that question of when are things going to get better here, it's kind of important to remember that since we have so many essential workers, we never really shut down to the same degree that urban places like King County were able to shut down to. So, we're not going to open up or move on to that next phase of opening up because essentially we didn't shut down to that same degree.
It's all good information. It's concerning information, but we thank you for sharing it with us. Thank you for joining us today, Enrique.
Thanks for having me.
And we turn now to correspondent Tom Banse in Olympia. Tom, there are still some counties stuck in phase one of the state's 4-phase reopening plan, namely Yakima County, and as we tape this, still Benton and Franklin counties of the Tri-Cities area. But there are some counties that are sort of champing at the bit to maybe go up to phase 4, or at least it seems on paper they could be eligible anytime soon. And so I just wonder, are there indeed some counties that may very well be at what they might consider the finish line, getting into phase 4, essentially kind of a full reopening, while other counties in the state are stuck way back at the starting line in phase 1?
Absolutely. It's a really odd situation to contemplate. There are about 8 counties that are just a couple days away as we talk here of being eligible and can advance if the state were to accept applications to the final phase, phase 4, which, as you said, represents something pretty close to back to normal. So aside from the mask requirement that we now have, new statewide, that would stay, and social distancing requirements, phase 4 is pretty attractive. But the counties that have kept a lid up to now on the coronavirus outbreak inside their borders and thus been at the vanguard, in some cases are right next door to counties that are back at phase 1. So just think about how maybe Skamania County in the Columbia Gorge borders Yakima County. It'd be kind of odd to be at phase 4, just 20 miles away from phase 1 county. At this point, the state is thinking that's a little bit too soon, I think, to go back to normal with coronavirus on the upswing statewide. So the application window is not opening right now.
It is technically possible that counties can go backward in phases, right? Not only go forward if the state Department of Health determines that the situation is worsening there. Are any counties at risk of going back to phase 2 or even phase 1 at this point?
At this point, the counties with the worst outbreaks are stuck at phase 1, so they can't go any further back, really. There are some counties, though, that are eligible to advance that are choosing on their own accord not to apply for the next phase of reopening, partly because things are not quite as stable as they'd like to be. I'm thinking, for example, of Spokane County or Grant County, where there are currently surges in cases, and the county health officer says, "Sorry, we're just not ready to loosen the screws. In fact, we need to double down a little more." So there's not anybody that's going to be knocked backwards at this moment, but there are some people and some counties specifically that are not ready to advance, even though they've spent the minimum amount of time at the current stage they're in.
Many people have advocated for years about better access to statewide transportation routes across the Cascades, high-speed rail. That's something you've covered quite a bit. But a new study out kind of maybe throws a little bit of cold water on some of that east-west high-speed rail network. What is that study?
The legislature allocated $250,000 last year to do a study of boosting east-west passenger rail. And they were thinking of reviving the Stampede Pass line, which goes from Seattle over the Cascades into the Kittitas Valley, then down the Yakima Valley to Pasco, and then onward to Spokane. There is a great deal of community interest. So they did a survey and found a lot of people were willing to try the train to go back and forth across the state, but it would cost hundreds of millions of dollars to upgrade the track to get decent travel times. So as it is now, if you revive that line, put some Amtrak trains on it, it would take 8.5 hours to go from Seattle to Spokane via the Yakima Valley and Pasco, which is about double what a car trip would take. So the cost would be high, and the actual ridership probably with those slower travel times would be low. And it doesn't really look like this train is going to leave the station.
Tom, always good to talk with you about coronavirus and transportation and all those other topics that you cover out there in the region. Thanks for joining us today, Tom.
My pleasure.
You can see more on these and other topics at our website, nwpb.org. Thank you for joining us, and remember to wear a mask out there in the unique Northwest.